What is high-functioning anxiety? Anxiety is often depicted as panic attacks, avoidance behaviors, or visible distress. But that's not the whole picture. For many, anxiety doesn't look like frantic breathing or paralyzing fear. It looks like being the overachiever, the perfectionist, the one who has it all together. Behind the scenes, however, these individuals may be battling a constant undercurrent of worry, self-doubt, and exhaustion. While it's not a formal diagnosis in the Diagnostic and Statistical Manual of Mental Disorders, high-functioning anxiety is a lived reality for many people, and recognizing its signs is the first step towards support, healing, and balance. High-functioning anxiety is best described as a form of anxiety that coexists with outward success. People with it often appear calm, competent, and productive. They might be high achievers, reliable friends, or go-to leaders at work. But internally, they may be plagued by overthinking, excessive worry, self-criticism, sleep difficulties, difficulty relaxing, and fear of failure or disappointing others. This creates a paradox. The anxiety fuels performance, but the performance masks the anxiety, making it harder to identify or treat. The following characteristics are often seen in individuals with high-functioning anxiety. While they may resemble positive traits on the surface, the internal experience behind them is usually driven by fear or stress. External traits include being a high achiever and goal-oriented, always on time or early, organized and detail-oriented, active and helpful in social settings, reliable and responsible, and having a high work ethic and motivation. Internal experiences often involve constant worry or rumination, fear of letting others down, difficulty saying no, people-pleasing tendencies, insomnia or racing thoughts at night, physical symptoms like muscle tension or stomach aches, and feeling like an imposter or fraud. Often people with high-functioning anxiety have learned to channel their anxious energy into productivity. In some ways, the anxiety becomes a driving force, but it comes at a significant emotional cost. Like most mental health issues, high-functioning anxiety can stem from a variety of causes, including genetic and biological factors. A family history of anxiety disorders can increase susceptibility. Brain chemistry and personality traits like neuroticism also play a role. Environmental and developmental influences, such as early life experiences, being praised for achievement, punished for failure, or growing up in a high-pressure household, can condition people to seek validation through performance. Social and cultural expectations also play a part. Cultural messages that equate self-worth with productivity or perfection can exacerbate anxiety. In competitive work environments, for instance, anxious behaviors may be reinforced or rewarded. Lastly, trauma and stress are significant factors. Past experiences with trauma or chronic stress can heighten anxiety responses and reinforce hypervigilant behaviors. Because people with high-functioning anxiety often maintain jobs, relationships, and responsibilities, their struggles may go unnoticed. However, the toll it takes is very real. Burnout, chronic overworking, and perfectionism can lead to mental, emotional, and physical exhaustion. Strained relationships, the need to appear fine or overextend for others, can lead to resentment or disconnection. Mental health decline, unacknowledged anxiety may contribute to depression, panic attacks, or substance use over time. Low self-esteem, despite accomplishments, individuals may feel unworthy or never enough. The invisibility of high-functioning anxiety often results in delayed support. Because they appear to be coping, others may not realize help is needed. Sometimes even the person themselves doesn't recognize it. How to cope with high-functioning anxiety. If you identify with the traits above, you are not alone, and support is available. Here are strategies for managing and healing from high-functioning anxiety. 1. Acknowledge and accept. Awareness is the first step. Naming the experience helps reduce shame and opens the door for change. 2. Challenge perfectionism. Notice where perfectionism shows up in your life. Ask yourself, is this standard necessary? Is it realistic? Who am I trying to please? 3. Set boundaries and say no. Overcommitting often feeds anxiety. Practice saying no to preserve your energy and mental health. Boundaries are a form of self-care. 4. Incorporate mindfulness and grounding techniques. Practices like deep breathing, meditation, or progressive muscle relaxation can help you connect with the present and calm the nervous system. 5. Get comfortable with rest. Productivity does not equal worth. Learn to rest without guilt. Recovery is essential for sustained success and well-being. 6. Reframe self-talk. Replace anxious self-talk with compassionate inner dialogue. For example, I'm doing my best. I don't have to do it all today. 7. Seek professional support. Therapy is beneficial for identifying core fears and unlearning patterns, as well as developing healthier coping strategies. Cognitive behavioral therapy, CBT, acceptance and commitment therapy, ACT, and mindfulness-based approaches are often effective. Supporting someone with high-functioning anxiety. If someone in your life may be living with high-functioning anxiety, here's how you can support them. Check in regularly. Don't assume they're okay just because they appear to be. Validate their feelings. Acknowledge the stress behind their success. Encourage rest and balance. Celebrate progress, not just productivity. Be a safe space. Create an environment where it's okay to struggle and still be seen as capable. Recommend professional help gently. Frame therapy as a tool for thriving, not just surviving. High-functioning anxiety in the workplace. Many people with high-functioning anxiety thrive in fast-paced or demanding environments, but these same workplaces can also reinforce their anxiety cycles. Employers and team leaders can support mental health by promoting work-life balance, encouraging realistic workloads, modeling vulnerability and self-care, offering mental health resources and flexibility. Creating a culture of openness can help people feel safe asking for help before burnout hits. Breaking the cycle, redefining success. Healing from high-functioning anxiety often involves redefining what success looks like. Instead of tying self-worth to productivity, it might look like slowing down without guilt, enjoying hobbies without being the best at them, taking rest seriously, valuing presence over performance, living from intention, not just reaction. Success isn't just about what you do. It's also about how you feel while doing it. High-functioning anxiety may be invisible to others, but it's not imaginary, and it's not something you have to manage alone. The traits that help you succeed, like drive, attention to detail, and empathy, can also be redirected toward healing and growth. If you see yourself in these words, consider this your invitation to pause. You are allowed to rest, seek support, and thrive, not in spite of your anxiety, but with a renewed relationship to it. Your worth is not measured by output. You are already enough. If you have gained something from this video, please like, subscribe, and share it with others it could help.